Dear students, welcome to R.A.T.S. Racing Against Time for Students in Pathology. Case history is of paramount importance. You people shall be understanding and answering my questions later on. A 45-year-old man developed severe chest pain and was brought to the hospital in a semi-conscious state. His skin was cold and clammy. He was not responding to verbal commands, but only to deeply inflicted pain. Pulse was steady, urinary output almost nil, and he succumbed to death in spite of intensive care. Look at the keywords on the screen and we shall come back. What is the complication that he had developed? Discuss the sequence of events and probable differential diagnosis, and what could be the autopsy findings. This is just to show the severe chest pain, which could be a myocardial infarction. Incidentally, that is not the diagnosis. The diagnosis is shock. It is an important essay question in all these subjects, and it can come as a short note, MCQ, or Viva OSA also. Please do follow. And I would request you people to kindly go to game for fame. In game, there is many a question that you people can answer. Otherwise, you will be like this. What is the expression denoting? Exams are cancelled due to COVID. So it is a surprise shock for us. Then what is shock as such? Shock is defined as a decrease in the effective circulating volume of blood, and hence decreased or inadequate tissue perfusion. I repeat, a decrease in the effective circulating volume of blood and hence inadequate tissue perfusion, which can be because of many a cause. This particular tabular column is of paramount importance, and you will have to memorize and write. Hypovolemic shock, decrease in volume. It can be because of hemorrhage. Various causes are there. Non-hemorrhagic also. Loss of fluids because of vomiting, diarrhea, or burns can lead to shock. Cardiogenic shock, where the cardiac output is decreased. Again, a lot of causes are there. Please remember a few, such as myocardial infarction. Sometimes, because of anesthesia, the patient dies on the table. Neurogenic shock. Septic shock is very important because it is a question for you people in medicine, in surgery, as well as in pathology. Caused usually by gram-negative bacteria and occasionally by gram-positive bacteria also. Anaphylactic shock is a type 1 hypersensitivity mediated by IgE. And there is a similar shock called as anaphylactoid shock, which is not IgE mediated. This particular tabular column, no excuse at all. Write this, get 3 marks extra. Explain the pathology. A beautiful schematic animation by Rebel. There is a heart in a state of shock or arrest, maybe a myocardial infarction whatsoever, due to which there is a stagnation, and then there is a backlog of blood which accumulates in the lung. So these are all the alveoli in which I am finding proteinaceous membrane, as well as there is a eosinophilic proteinaceous material as well as eosinophilic membrane. So this is what? How it develops, we shall be seeing later on. There are different stages of the shock. Stage of the shock is a definite question for you people. There are 3 stages: non-progressive, progressive, and irreversible. The non-progressive is otherwise called as compensated shock or reversible shock. In the sense, even if you lose 500 ml of blood nothing will happen to your life. The body compensates for it because of the homeostatic mechanism. And there is a release of some substance called as vasoexcitor material. This causes peripheral vasoconstriction and allows passage of blood to the vital organs such as the heart and the brain. Also, these mechanisms come into force. Neurohumoral mechanism, tachycardia, widespread vasoconstriction, fluid conservation by the kidneys, and maintenance of the blood pressure by the heart. What is this procedure? Try to find out. The other stages of shock include progressive, which is the second stage. There is a tissue hypoperfusion or hypoxia, due to which there is some damage which leads to glycolysis and lactic acidosis. When you go to the first chapter, this is of importance. Lactic acidosis demarcates the reversible and the irreversible injuries. There is a reduced pH. And from now onwards, there is a dilatation of the peripheral arterioles because of the vasodilator material. The cardiac output is also decreased, and there is hypoxia to various organs, as a result of which it goes in for progression. Even now, it is probable with intensive care to revive the patient. After which, there is a condition or stage called as irreversible shock. Severe cellular and tissue damage. Survival is not possible even in a tertiary hospital. Massive release of the lysosomal enzymes causing damage, decreased myocardial contractility, and various organ damage. In the kidney, we can have acute tubular necrosis. Also, if it is going to be a septicemia, there can be a bacterial septicemia that can lead to further deterioration. What is the ultimate mechanism of injury in a case of shock? It can be ischemia, lack of oxygen. Second one is release of free radicals. Third one is mediators of inflammation. Please remember these three things: ischemia, free radicals, mediators of inflammation. The pathophysiology of cardiogenic shock. So there is an ischemia or infarction, as a result of which you find that there is a pump failure. When the heart fails as a pump, you find that there is a myocardial oxygen demand also. This is a cycle that is going on one side. On the other hand, there is a decreased amount of cardiac output, decreased coronary perfusion. This again damages the heart. But what happens elsewhere is there is decreased perfusion, lactic acidosis, as a result of which there can be widespread tissue damage. There is EDV, and then there is the afterload or left ventricular wall stress. So please remember these. These can be the causes for myocardial damage. One can be infarction, 2 is arrhythmias, 3 is tamponade. The heart is not able to expand. Stenosis or rupture of the papillary muscles. Any of these can lead to a shock. Thanks to Anesthesia UK. A beautiful chart for understanding. First things first. So this particular one, I would like you people to kindly memorize and write. There is a hypovolemia. There is a reduced central venous pressure. There is a reduced cardiac filling, hence decreased cardiac output. And then there is also a decrease in the arterial pressure. This stimulates the peripheral receptors as well as the central receptors. Initially, there is a nerve stimulation and adrenal stimulation, as a result of which there will be vasoconstriction. And these organs are prevented from getting the blood. The blood goes to the vital organs. If it is not treated, then it goes in for a progressive shock. This is what EDV I mentioned is end diastolic volume, ESV is end systolic volume. This formula you can Clarify your doubts with the professor of medicine. Septic shock. This itself is a university question asked any number of times. The synonym is toxemic shock. Septic means it comes from this word, shocken, which means jerk or jolt, Dutch word. Usually by gram-negative endotoxins, gram-positive exotoxins. The causes are mainly gram-negative bacteria from the genitourinary or alimentary, respiratory or skin. Less often it will be gram-positive. This is just the introduction, and there can be an activation of the immune system leading to severe inflammation, or there can be activation of the macrophages and the monocytes. Let us see what happens because of this. So this is a case of a bacterial meningitis, and then there is a release of the bacteria into the peripheral blood, leading to what is called as septicemia. Meningococci, this is the bacteria that can cause a meningitis. There are others also. As a result of which there is widespread shock, there can be hemorrhage in the adrenals, and it is a syndrome called as Waterhouse-Friderichsen syndrome. This can be asked as an MCQ. If you do mention, you get a point for it. And this is what you people should write. There is a pro-inflammatory cytokine, loosening of the endothelial junctions, leakage of fluid, and increased vascular permeability, accumulation of edematous fluid throughout the body. Since there is an accumulation, there is no return. Since there is no return, there is impediment in the tissue perfusion. All this can lead to a decreased fluid or stagnation. In this condition, there is no loss of blood, but then there is a peripheral pooling of blood. So this particular steps you people should remember. Remember the last one, activation of the mast cells can lead to histamine release, leading to endothelial permeability. That is what is mentioned here. So please read the pathogenesis of septic shock. In general, this is another one. Hypoxia, what happens is there is a damage to the cells. At the cellular level, what happens, we people should mention. This leads to glycolysis. As I mentioned earlier, it is given in your first chapter itself, which will lead to lactic acidosis, the culprit. There is also the production of other substances such as vasodilators, kinins and prostaglandins, which can result in peripheral pooling and then a decreased cardiac return and output. That is why you get a fall in the BP. There is also endothelial damage leading to permeability. This again can lead to peripheral accumulation and decreased cardiac output. All of which can ultimately lead to hypoxia and damage to the vital organs such as the heart and the brain. There is no revival at this point. Please mug up this chart. What are the various organ damages in shock? In the central nervous system, the manifestation can be septicemia, encephalopathy. Rarely there can be red neurons or cortical necrosis. In the heart, it can be in the form of myocardial ischemia, infarction, tachycardia. In the lung, respiratory distress syndrome, leading to the hyaline membrane and the accumulation of fluid. Gastrointestinal tract, there can be erosive gastritis, bleeding. Pancreatitis can also occur in shock. Adrenals, massive hemorrhage called as a Waterhouse-Friderichsen syndrome. In the liver, ischemic hepatitis, and hematologically there is a condition which can again happen in septicemia, disseminated intravascular coagulation. Metabolic, glycogenolysis, and in the immune system, there is depression. Please by heart this one, what are all the various organ changes that can happen? Added to this, there can be the kidney, where there can be an acute tubular necrosis. By heart. So this is the adrenal, wherein there is a hemorrhage, the Waterhouse-Friderichsen syndrome. This I missed in the previous table, please include. In the kidney, there can be necrosis of the tubules, which is called as acute tubular necrosis. This by itself can be a question for you people. Please do read and go back to my class on systemic pathology. This is a beautiful flow diagram summarizing the entire thing. So the shock can be because of hemorrhage or fluid loss, myocardial anaphylaxis, neurogenic or septicemic causes. And these are the results of which there is a decreased output, there is a hypoxia, and that can lead to damage of the cells. There can be release of the cytokines and acidosis. Ultimately, there is a shock, which means there is a decrease in the effective circulating volume of blood, manifested by means of oliguria in the kidneys. There can be hemorrhage in the gut. In the lung, there can be ARDS. And there can be bleeding in the gastrointestinal system as well as pancreatitis. Ultimately, the death is due to cardiac failure. This particular one, if you people can read and understand, it will be of great help. It is a difficult chart for you people to write in the exam, but the earlier ones you people can do. And what are the clinical features? In the early stages, not associated with hypovolemia, the patient is febrile, there is warmth, it is a flushed skin, there can be some amount of shivering, hyperventilation because the body is trying to compensate, and there can be a bounding pulse. The cardiac output is increased. But in the late stage, this is a classical symptom of shock: hypovolemia, altered sensorium, cold and clammy skin, weak thready pulse, oliguria, DIC, and GI bleeding. This is what I had mentioned in my case history. If it is going to be a septicemic shock, the patient will not be having a cold, clammy skin. Instead, there will be some amount of warmth. There can be confusion because of septicemia. So please do differentiate between the two conditions. It is important for you. I would like you people to kindly recall the definition, causes, types, stages, pathogenesis, septic shock specifically, organ changes, including acute tubular necrosis. Sorry for having missed it. Clinical manifestation and the flow diagrams. Thank you.